Hello everyone. In this video, I will be discussing about the role of compression sutures and air descemetopexy in acute corneal hydrops. This is a case of a 19-year-old female who was a known case of Down syndrome and both eye keratoconus brought to our emergency by her parents with a complaint of not able to see with the left eye for one day. She was uncooperative for visual acuity assessment. On sitlant examination, we noticed a large area of central ectasia and stromal edema. A clinical diagnosis of acute corneal hydrops was made. Initially, she was started on medical management with topical antibiotics, steroids, cycloplegics, and anti-glaucoma medication. But due to worsening of the corneal edema, she was planned for compression sutures and air descemetopexy. Why compression sutures and air descemetopexy? Persistence of corneal edema, it incites the inflammatory response in the stroma, which leads to the formation of new vessels, which in turn increase the risk of corneal graft rejection when keratoplasty is performed for visual rehabilitation in such patients. What is the principle of compression sutures and air descemetopexy? It shortens the period of resolution of corneal edema by helping in the apposition of the edges of the descemet tears, and it acts as a barrier for the further entry of the aqueous into the stroma. In our patient, we took full thickness radial 10-0 nylon sutures in the mid-periphery. Total of 8 sutures were taken, which were equally spaced in the mid-periphery. To increase the zone of compression, suture bite with maximum possible length was taken. And in the end, full chamber air bubble was placed with the help of 29 gauge needle. On day 1, post-operatively, we saw drastic reduction in the corneal edema, which almost resolved after 4 weeks. Corneal sutures were removed after 6 weeks, and on day 60, we can see the acute hydrops has resolved with central scarring. So what we learned from this case, compression sutures combined with air descemetopexy, it accelerates the resolution of corneal edema, which decreases the risk of vascularization, which in turn decreases the risk of graft rejection when keratoplasty is performed for visual rehabilitation in these patients. Thank you for your patience listening.